Florida is talking about what fueled the opioid plague. And they had 5.5 billion pills in the state of Florida. And of course, like many other states, they are blaming, the pharmaceutical company for ramping up these drugs and selling them as non addictive. Well, one thing that I noticed that's very consistent, ladies and gentlemen, these folks don't take responsibility for nothing. Seriously, don't take it. Nothing is ever their fault. So this came out in the Miami Herald, July 25th, 2019. So in a 7-year span that saw the opioid plague reach crisis levels, 5.5 billion hydrocodone and oxycodone pills flooded into Florida. They poured across the state through shady clinics that became known as pill mills, but hundreds of millions streamed through grocery store chains and pharmacies, CVS, Walgreens, according to newly released data provided by the DEA to the Washington Post and analyzed by the Herald Times. One Walgreens in Port Richey alone received an average of 74,706 pills per month. That is outrageous. The city's population is 2,831. My goodness, what, everybody in the town had opioids? Overall, the number of opioids that moved through Florida was second only to California. It amounted to an average of 42 pills per Floridian per year from 2006 through 2012. While the figures may be new, the takeaway is not. Florida's lax regulation on pain clinics lured addicts across the state lines and helped fuel the national crisis. So, ladies and gentlemen, in 2010, they are claiming, and trust me, they're way off on these numbers, by the way, an estimated 7 people per day died in Florida from prescription drug overdoses. Some reports have put the number higher. Of course it did. There is no consistency in these numbers. You'll have some articles that will stay, that will still say 91 deaths per day in the US, and we know that's wrong. That couldn't possibly be right. And then I read another one, it says 200 deaths per day, and then 130 deaths. So they're not telling the truth. As far as I'm concerned, y'all, all of those numbers are low. Too low. Especially for an addiction that has gone on for 20 years. Okay, Florida cracked down on rogue pain clinics starting in 2009. Within a couple of years, it banned one-stop clinics from distributing drugs, barred ex-felons from owning clinics, and established a state database of controlled substance prescriptions to track potential doctor shoppers as well as doctors who repeatedly overprescribe. The measures caused many of the pill mills to shut their doors. Number of pain management clinics in the state dropped from 921 in 2009 to 371 in 2013, according to the University of Central Florida researchers. But the powerful companies that manufactured and distributed the painkillers under brand names like OxyContin have yet to face major criminal penalties, and they won't. These people are billionaires, and America has this thing about not jailing billionaires. Okay, you can say Epstein, but I don't believe he's going to be in there long. Information about the role of a manufacturer and major pharmacies played is still emerging as civil suits against them work their way through the courts. Cities, counties, and towns plagued by their population addiction problems have argued in recent court filings that pharmacy giants like Walgreens, Woolley neglected their legal duties to block suspicious orders and alert federal authorities. Walgreens said in a statement that the chain stopped distributing prescription controlled substances in 2014, and it has been an industry leader in combating this crisis. Even while the lawsuits continue, Florida's elected leaders have continued to accept millions in campaign contributions from the corporations that played key roles in the plague. According to the pill data, 90% of the opioid painkillers prescribed in Florida were manufactured by four corporations. You know what, ladies and gentlemen? They've been suing these people now forever. All right. And suing these corporations have not slowed down any distribution of the drug at all. It's still going strong in this country, big time. So you have Actavis Pharma Inc., Spec GX LLC, PAR Pharmaceutical, Amneal Pharmaceutical LLC. 11 companies distributed 90% of the pills, including Walgreens, CVS, Walmart, and Publix. Those 15 corporations and key people associated with them have given at least $22.6 million in campaign contributions to candidates and committees in Florida since 1993, a Herald Time analyst found. Um, OxyContin, controlled release version of oxycodone, was approved by the U.S. Food and Drug Administration in December 1995. That includes 8.4 million from 2006 to 2012 and another 12.1 million since 2013. Wow. Money was talking in Tallahassee, unfortunately, as people were dying, he said. Well, America don't value nobody's life. They don't care that you're dying from these drugs. And it doesn't matter what president is in office, ladies and gentlemen. That don't make any difference. This plague is not going to stop at all. The companies donated to candidates for the highest statewide offices, including former Agriculture Commission Adam Putnam and state legislative leaders like Wilton Simpson and House Speaker Jose Oliva of Miami Lakes, as well as about 180,000 to former Governor Rick Scott, who now is the U.S. Senator. Yeah, he is in the Senate. I forgot about him. Both Oliva and Simpson, who joined the legislature in 2011 and 2012, respectively, pointed to the progress that the legislature has made in recent years by funding programs for addiction, um, treatment drugs like Vivitrol, upgrades to the prescription monitoring database, and a new law passed this year that will allow Attorney General Ashley Moody to use the information in that database against drug companies in Florida's lawsuit against these companies, which is state court. We have been trying to get our constituents to help. They need get our constituents to help they need, whether it's mental health or families getting treatment, Simpson said. All right, so they're doing what you see a lot of states doing. They're trying to cut down on so many people getting prescription drugs, and I'm telling you that is not the answer. That is never going to be the answer as long as you have the illegal drug on the street. It doesn't matter what prescriptions you cut down on. That has never been a factor, and it never will be. I mean, that's just the way it is. All right, so there's a video here. Let me play this video.
Relegated to desperate souls hiding in the shadows now impacts our friends, families, and co-workers. More people are addicted to opioid painkillers than ever before.
I believe that over the past 20 years, definitely, the indications and the setting in which opioids are provided has changed dramatically.
Mayo Clinic pain management specialist Dr. Michael Hooten says that's good and bad. People are able to get relief from severe pain, but they're also able to get prescriptions for opioids when less addictive options, such as ibuprofen, may work just as well.
If they are predisposed to develop addiction, either neurobiologically or from a behavioral perspective, then all of a sudden we are selecting this group of individuals who may go on to have long-term problems.
Dr. Hooten says educating people about the dangers of opioid misuse may be an important step in managing this public health crisis. For the Mayo Clinic News Network, I'm Vivian Williams.
Okay. Well, ladies and gentlemen, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.